What about schools? How do you handle children in schools as far as food allergies go?
So in schools right now, they're able to keep an EpiPen. Every school's different as to where they have to keep that pen.
Now, what's an EpiPen?
So an EpiPen is an auto-injector. It's something that you can use by yourself to inject epinephrine, which is the medication that is the only real treatment to reverse an acute, severe allergic reaction.
So if you have a severe allergic reaction to foods, or if you have a reaction, you eat, I've got some peanuts, I'm starting to break out in hives and my lip is swelling and my chest is feeling tight. Can I wait and see what happens?
Yeah, no, and definitely in that situation, if it's anything more than skin symptoms and you've eaten a food you're allergic to, that absolutely, epinephrine is the main treatment.
So tell me about the types of epinephrine that's available for adults and children and the devices.
Yeah, so the two main ones out there is the EpiPen, which has been around for a long time. It typically comes with two pens that are hooked together so that you can have a second dose 5 minutes after the first if you need it. And it's very simple. You just take off a blue cap, that's a safety cap, and you have to jab it into your leg in this area here on the lateral thigh, and count to 10 to let the medicine go in. And then as soon as you do that, you call 911. Okay.
So, and when 911 comes, do you tell them, I gave myself some adrenaline, I'm going to be okay, you can go back home?
No, you still definitely go to the emergency room.
Because what can happen?
Because it could, the reaction could be very severe. You may need another dose, and you may certainly need more therapy.
Now, you talked about the EpiPen. It's a device you take off the blue hat and you hold it into the thigh.
Yeah.
What's the other one?
And then there's a new one called an AuviQ, which is a device that actually talks to you. So you pull off a safety cap, and it tells you exactly where to put it and when to press and when to let go. And so it's really good in certain situations.
It sounds pretty cool to do.
Yeah.
Do they have different doses? In other words, if you've got a thin, small child versus an adult?
Yes, they both have pediatric lower doses, and they have adult doses too. So certainly based on the weight, you get different pens or different.
How fast does the epinephrine work?
It usually works within 2 or 3 minutes. It's fairly immediate, but sometimes you will need another dose, and you may need more therapy if you start wheezing or blood pressure decreases too. So
it could be a pretty scary situation.
Yeah, absolutely.